because the theme for this part of care it's had many names, level 2, intermediate care, transform care, is exactly that, is that we're kind of shifting from helping the system soften the external layers to actually helping to become, as a person on the table, a little bit more participatory, and which is pretty radical for most types of body work. Most people, who are receiving most types of body work, not all, but most, lie there kind of passively, right? And the practitioner does something to them. Well, in level 1, if you kind of want to, if you can imagine this, we talk a lot about this in the way that our system adapts to different life events. And so I'm not going to go through and do a whole review of basic care level 1 class. If you do want a refresher, absolutely feel free to come back to it. Dr. Sweeney's doing a phenomenal job with those. But one of the ways that our system becomes encumbered with a less than 100% expression of physical energy, mental, emotional energy, right? And also biochemical energy, like how is the energy in our biochemistry, our immune system, our red blood cells, our white blood cells, our organs that are producing hormones, right? All of that is intricately working. And the system that's regulating and monitoring that is, as you probably remember from level 1, the nervous system, right? Had the beauty of taking care of a 4-year-old today and talking with somebody who's also pregnant, and talking a little bit about, they were asking, hey, do you take care of pregnant women? And what happens in the second trimester? Well, one of the things we do know now is that the auditory system is fully developed. So in second try, the developing fetus can literally hear, I believe it's up to about a 6-foot radius around the bubble. So one of the people I've had the privilege of taking care of, who is 4, had some developmental delays, challenges, physical restrictions with movement and coordination. A lot of body system functions were repressed. And so in the history, one of the things we were talking about was stress response. And she looked at the emotional stress and she thought that was really interesting. And she goes, well, during my second try, one of the things that, and I didn't know, but I was doing for our family was going and advocating for my husband's father, who was having cancer and a diagnosis and all that. And so one of the things that she said, it was a particularly stressful few months. And so, for her, she could tell her whole system was being very stressed out. And she was curious about whether or not that may have played a role. And again, hard to say for sure, but we do know that the nervous system is the most, it regulates all the cells, organs, and tissues of the body. And so if there is any kind of a stressor, whether it's a physical stressor, an emotional stressor, or a chemical stressor, it changes the relationship that the nervous system can communicate with our cells of our body. And so really, as you guys may remember from my level 1 workshop and my fantastic artistry, right, is, kind of the simple elements of the nervous system. We have the brain, we have the spinal cord, and we have all of the nerves, right? 31 pairs of spinal nerves that go to every single cell of your body, right? Obviously not the red blood cells, white blood cells, lymph cells, but any tissue cell of the body has 3 to 9 nerve endings done directly into the cell. And if there is direct pressure or stretching or twisting on that nerve, we know that the message, the communication from the brain to that cell, whether it's a leg cell or a kidney cell or a bladder cell, we know that the communication to that cell, and we know the messaging from that cell up to the brain that allows for that regulation to occur, right, should be information out, information back, systems constantly responding to the demands of the internal and external environments. If that, we know that it takes about the weight of a dime, about 3 to 9 ounces of pressure on a nerve to change the signaling through that nerve, which is not a whole lot, right? So a lot of people always ask us, like, how does such a light touch work? Well, the interesting thing is that in our culture we have a pretty interesting bias towards large force equals solution. Certainly large forces do provide large inputs, but our nervous system, in fact, if you want to practice something with anybody you care about, practice, in an honoring way, using large, like a deep pressure, and seeing how much you can feel or determine about their body tissues, and then practice using a really light force and watch how much more you can actually discern about that body. You'll also watch the person's physical response. You'll notice as you put more force, even though the person may like the force as a dissipation tool, the person at a certain point, the body will recoil around it, whereas you apply a soft force, you'll notice the body tissues actually melted open around your hand, right? It's not a new principle, it's just common sense. But with the work that we do, rather than applying a large force to restore or improve that flow of communication between the brain and the body, we know that in response to emotional and chemical stressors, that the central nervous system goes into a fight or flight or a stress response that's kind of the middle and the lower parts of our brain kind of fire off, and they create a stretching, right, in either side to side bending. So the spinal cord will do this, or this, or this, or all of the above, and it will deform the length of the cord up to 2.5 to 3 inches, right? And that was discovered in the late 70s by a neurosurgeon named Alf Brigg. He's a Scandinavian neurosurgeon. And so we know that because the attachments to the spinal column anchor into the pelvis, into the neck, with that high degree of neural attachment, that we can provide a very light force at either or both of those two ends, which can temporarily inhibit that stress response in the middle and the lower brain, and start to fire off the cortical regions of the brain, which is where a lot of stuff happens, including self-awareness, the sensory cortex, the motor cortex. All of that starts to fire back off again. That part of the brain can also inhibit, which is a fancy way of basically saying it can suspend the way that our brain has told our body to tighten up characteristically over our history of physical, chemical, emotional stretches. And that creates a global unwinding or resetting of the way we carry ourselves. The messaging that opens up can allow the connective tissue around the membrane of the cell to allow the biochemicals that need to go through to switch on and switch off, the regulatory proteins maybe for the way our body can adapt to a stressor, RNA and DNA. It can also change the mechanical tension on the parking spaces on the cell, called the receptor sites, that allow certain nerve proteins to go across that cell, which can activate immune system responses. All of that stuff happens. In fact, you guys may know this, but before we actually have a feeling in our brain, we actually have a body sense or a tightening. And this was discovered by Candace Pert. You guys may know her. She's a very well-known, she's passed away now, but Candace Pert, PhD, and her husband Michael Ruff, they're neuroimmunologists, and they did some groundbreaking research in the 1980s and 1990s when the whole issue around HIV was becoming very prevalent. And what she found and discovered in her lab was that under stress, the stress response changes the mechanical tension on the membrane. It changes the space and the way the parking cells are organized. So instead of a parking cell, let's say around the membrane that's parked like this, that should look like that, because the stress response on the nerve will alter the membrane potential, so it changes the mechanical tension. It changes the shape of that parking structure to like this, so that a cell that should have been a square can no longer bind. So it limits the activity of what can actually be switched on in the nucleus of the cell. So our nervous system, our cellular capacity for responding to events is limited, right? It doesn't have 100% capacity to it. She actually wanted to do a research study with network care patients and do a radioisotope study of how the different patterns of tension change mechanically and what actual biochemical markers are result or affected by which tension pattern in the central nervous system. But it's an interesting journey to try to get funding in the realm of medical research as a chiropractic study. So that's kind of interesting, right? And so, hi, you made it! Yay! Woo-hoo. We were rooting for you.
Thank you.
Good to see you.
So in level 1, right, or basic care, discover care, really the objective through those super duper light contacts that are literally about 3 to 9 ounces of pressure, super duper light, very characteristic specific spots are designed to switch that part of the brain on. The contacts are about a second or less, and that switch in the central nervous system, it inhibits the mechanical pulling of the stress response. And the developing response that we look to see happen in level 1 is the breath, right? Respiratory response, remember that one time ago? And the breath response, well, it has a lot of impacts. It brings oxygenation, it allows tissues, yes, exactly, to move and glide. And the effect of it as the breath glides over the surface tissues of the spine is it starts to gently dissolve the outer layers, right? That's its purpose, is to start to soften from the inside out, but to soften and create less tension, more mobility. The breath at first seems a little bit innocuous for most people just because we live in a big hit culture that if I'm not being whacked or bombarded or attacked with some crisis or something, then I'm not actually able to notice those subtle cues. And so that part of it, that's the lower part of the mid part of the brain. It's all about let me respond. One of the interesting things about the stress response too, especially when it goes on for a period of time, is it also produces the biochemistry of anesthesia. So for a lot of people that are used to high levels of stress, they can thrive under pretty adverse situations, which is a phenomenal capacity, but their capacity to notice subtle changes within the neural system is usually quite diminished, just because the biochemistry, the stress biochemistry, inhibits their ability to notice small, subtle things, which can include things like how to be emotionally sensitive to themselves, to others, noticing cues, facial cues, postural cues, when someone's upset, when someone may not need to have input or be asked a question. Those are the subtleties of just about every interaction that we can ever have, whether it's with our child, with our significant other, with someone at the grocery store, or our best friend. When the central nervous system is in a greater state of ease, it has the capacity to start to notice more subtleties. For some of us, as that occurs, as the subtleties start to soften, it generally provides the general trend as a dissipation, so things start to melt, things start to glide, move, posture starts to feel easier, there's a little more range of motion. The experience of breath moving through the body tissues expands so that people can start to notice more subtleties. And if you think about it, if you have a palette of paints, right, and you're a painter and you're looking and all these are orange, but imagine they're all different colors, is that if all you know is big force, big reaction, you're limiting the capacity of what you can perceive and what you even consider as a response to being able to have lots of other subtleties. The way that I notice the position of my body, my energy, my breath, my emotions, all of those things are what makes us whole, right? And that ties into what we talked about in the initial part of level 1 workshop, which is health, right? If you look at the root word, it's an Anglo-Saxon root word. It basically means to be sound or to be whole. There's a kind of it's not an exact translation, but it implies, just like the World Health Organization's dictum is that health is not merely the presence or absence of disease or illness or a condition. It is the optimal expression of physical, mental / emotional, and social well-being, right? I was actually rereading some of the updates from the World Health Organization and what led them to that and why they actually had the word social in there, and they were actually for 2 reasons. One was our interactions, right? Because we're communal beings, right? Even though the last 3 years has made a significant impact on most people's ability, willingness to connect with others for various reasons, we are social. We get social cues. That's how kids get socialized in school, to learn how to recognize facial expression, body language, their own emotions, regulate their own emotions. We need to do it in the presence of others, and everybody's got a slightly different rheostat to determine how their unique expression. Some people are really, really external and social. Other people are just a little bit more, but there still is interaction that's absolutely necessary for us to regulate our own internal environment. So as we start to move into level 2, one of the things that we start to see is the body goes from a breath response primarily into a movement-based response. And so there's a different wave form that develops, a different way of applying those forces, and then how that wave actually starts to move through the spine and the effects that it has on the improving function of the central nervous system, and obviously how it directly translates into the greater expression of health and life. So that's a topic of our conversation today. Woo! Isn't that exciting? So one thing that's kind of interesting, and this is something I like to address, is that, some people, obviously know that the nerves go to the physical structures of the body, muscles, tendons, ligaments, discs, etc., like that. And some people are surprised to learn that nerves go to their organs. I know it's not really that shocking, but what I find interesting is one of the ways, that we primarily figured out that there's what's called a somatovisceral reflex means that we do have nerves that go to the organs of the body, all the organs of the body, is that in 1924, a very curious medical doctor named Dr. Henry Windsor in Pennsylvania was looking at the relationship between minor curvatures in the spine, so minor malpositions, that were, those nerves were affected, and he was doing autopsy studies on people that had died from organic illness, meaning their organs had failed. And he did somewhere around 100 cadaver studies, I think, a blend. It was like, I think it was in the 85, human cadaver studies and 10 or 15 animal cadaver studies. And what he found was like a 97-degree correlation between minor alterations in the position of the spinal curves and the nerves that were in those minor changes that were actually the cause of death to whatever organ that they went to. And that was called the Windsor studies, and that's how we ended up finding that there was actually a nerve supply, or a reflex that goes from the spine and regulates the way the organs are designed to function. So that was kind of cool. And certainly everybody has a 200 IQ these days. You can certainly pop that into Google and be like, hey, Henry Windsor, and it's kind of interesting to look at. But one of the things that happens in this second level of care, transformed care, is the nervous system starts to develop a desire for going deeper in the system. And so what we found with the research at University of California, Irvine, we did a 2,818 person research study over about a 3.5 year period of time. What we found was that as people started to get somewhere between 2 to 4 months, the respiratory response started to basically flatten out, okay? Meaning that it was no longer a novel stimulus for the person on the table. Brain was like, meh, got the t-shirt, already been there. And so that was interesting. And so in developing the work, what we found was that if we started to actually take longer contacts and it supported a different type of a response. So it went from a respiratory response to the body kind of wanting to start to create a movement-based wave response. And that movement-based response develops into like 3 little chapters, if you will. Each one has a very specific outcome and a way of working with you on the table. And it has a very specific direct relationship to the effect and the improving the function of the nervous system. So what I'd love to do is just talk a little bit about that and then demonstrate it on the table with Dr. Sweeney so you can see me work with him. And I'll do my best to kind of comment on it and describe and show you what we're working with so you can kind of help get those 3 aspects of it, and also kind of see where you're at in your care and help get a little more of an idea of like, okay, how can we work with that and advance your progress. And then after I do the demonstration with Dr. Sweeney, I'll share with you and show you an additional somatic exercise, so a movement breath exercise that links the higher part of the brain in to certain neural hubs or somatic anchors with a lot of nerve supply that helps increase our awareness, and through the development of a movement-based response starts to kind of simulate the wave that we're working with, so it starts to help churn the system up. That's really the big thing in level 2 of care too. When you wanted to change something, what had to happen? Like really change something, not just kind of change sort of something. What had to happen? Or what went along with that change? Anybody? Action. What were you gonna say? Discomfort, right? What do they say about change? Where does it happen? Here's our comfort zone. Right? Right? What we saw in the research study though is that and this is what early network used to do, we went from here all the way to here. And some people had some phenomenal peak experiences, but what we found with the research by doing the same sociological research, and that's what helped us develop the levels of care, is that a lot of people had peak experiences that changed their lives, but it was not sustainable. The system didn't have a groundwork, a framework with which to build it to make it a sustainable, integrated experience, not only for their physical structure, but how that radical change in their nervous system could help them change their lives. Because here's the thing about the nervous system, which you guys I'm sure can make sense of, is that so what we're dealing with is the brain. The spinal cord runs through the bones. Like we talked about, those nerves go to every single cell, organ, tissue, gland of the body. And so it's really, if there's a distorted, this is a pretty drastic, but if it's literally distorted, and I've had the privilege of working with a young boy who in 25 years of practice had the largest curve that I've seen in taking care of somebody. He had a 98-degree curve. And he had been going to Shriners Hospital getting x-rays every 6 months since he was 6. I got to see him when he was 9. And I took the films for my own wanting to look at it and get my own weight-bearing x-rays, because all the x-rays they'd taken were laying on the table. And I measured it and I went, oh my gosh. And the apex of the curve was right in the place of the nervous system where it went to the kind of the esophageal part, the stomach junction. And guess what one of his most significant complaints was, in addition to physical pain? Reflux. Yeah, that would happen most nights, all night, right? So this little, from 6 to 9, he wouldn't get sleep. Could you imagine that? So a huge developmental period of time, obviously neurologically, biochemically. And so his mother brought him in, and I looked at his films, I looked at all the history that he's had for the last 3 years at Shriners Hospital, and I looked at him, and I even asked a mentor of mine, I said, and he got back to me, and he's like, wow. He goes, that is, without a doubt, the largest curve that I've seen, especially, and he hasn't even reached puberty yet, which is where there's a huge amount of skeletal maturity that's about to take off. So I sat down with his parents, I said, look, I've worked with scoliosis before. Certainly there's distortion in his nervous system. I really can't promise anything, but I'm willing to give it a try if you are. Because of the severity of the curve, it was necessary to see him quite a lot. In the first 2 months of care, first 3 months of care, we did another x-ray at that time. Actually, no, he had his appointment with Shriners, so it kind of timed the 6-month checkup. It was so for the 3 years, his curve, it kept getting worse, kept getting worse, kept getting worse, kept getting worse. This was the first time in 3 years where his curve did not get worse. And what his experience was that he was not throwing up into his mouth most nights. He was sleeping. When I first met him, he was this kid that wouldn't even give you eye contact. He would look down. His energy was like this. He would just hop up on the table. He was almost lifeless, right? And over the last kind of month before we did that checkup, he would come in, he would be smiling, and one day, I'll never forget it, he got up on the table, he got his adjustment, he got up, he reached into his pocket, and he looked at me, and he goes, Dr. Chambers, he goes, this is from my allowance, and I wanted you to have this, because I feel so great. It was a quarter from his allowance, and he gave me the biggest hug, and I was just like, almost like blown away, because it was so out of character for him, and I was just like, thank you. Thank you for the opportunity to take care of him. But that is and what's cool about it is that, he was so young, so he didn't have 40 years, 50 years, 30 years of adapting to the way that both the body and the organs, and just, can you imagine adapting to getting used to throwing up and having reflex for that long, right? You know what? And that's when I talk to a lot of adults that have chronic issues, they're like, oh, but I'm used to it. I get it. And wow, really? You know? So change happens outside of our comfort zone. To make that transition as graceful and easeful and integrated with the nervous system, that's how the levels of care were developed. We found that if we created ease in a respiratory response and dissipated the outer layers, it made that transition more graceful and more sustainable over time. Doesn't mean, though, that when we do actually get out here, that sometimes things don't get a little bit uncomfortable, because they sometimes can, physically, emotionally, as the system is choosing, experiencing a range of movement or range of energy, an expression of energy that's outside of what it's gotten used to or had adapted to. So sometimes we functionally adapt to certain stressors, right? Relationship stressors, financial stressors, family stressors. We get used to certain patterns. And so if the system starts to operate higher than it's normally used to, there's automatic unconscious pathways that very commonly will want to bring us back to what we've been conditioned to experience, right? And so working with that little threshold is an interesting one, both internally for each one of us, but also watching the system grow and expand and start to do, when it starts to touch into some of those internal layers of the onion, the other onion I was talking to you about, the body can sometimes retrace old patterns. This reminds me of when I broke my shoulder when I was a kid. Oh my gosh, I haven't had asthma since I was a teenager. Wow, that's really weird. Wow, you know, the digestive issues, I haven't had those since I first started coming in. It's really weird that they're coming back. I'm kind of scared, right? All natural responses. But when the brain and the body are communicating more effectively, the intelligence within from that communication that's being restored is the thing that's driving this show. And so Dr. Sweeney and I are doing our best to follow your body, because it's the one at this point that's kind of guiding us to where we need to be, helping kind of direct it a little bit, making sure we're kind of looking for certain outcome. But as that wave develops, it kind of peels back those layers so the system can clear out as much of those old patterns, physically, chemically, emotionally, as it possibly can, and develop something new that's more currently reflective of who you are today, how your system wants to experience life today and going forward, so that you don't have to stay stuck in those patterns. Physical health, emotional health, mental well-being, social health, that it can actually start to carve a new trajectory to a completely new baseline. And that's exactly what we found in level 2. Sometimes there's a little plateau, or it dips, like things are getting a little worse, but that's usually right before the system starts to break free and get to a completely new baseline. And once we get up to here, that's where we start working with people in wellness care or advanced care to help that system stay, so this stays as the new baseline and it doesn't drop back down to where it's been previously. So it's a super exciting time, and it does require new ways of experiencing and working with your body. So what I'd love to do is, if it's okay, have Dr. Sweeney come out and show you a few things and kind of walk through the different kind of elements of the level 2 or transform care, so you can see them and kind of get a sense for what they look like and what they would feel like on the table. So,
I'm glad I wore my fun socks today.
you wore fun socks? What kind of socks did you
There's
wear?
a scale of fun socks.
You know, I wore my fun socks today. I wore my gluten-free pizza socks today. They're gluten-free. I swear they're gluten-free. What do you got?
These are so boring.
Oh, those are very cool.
It's a competition.
I know. Yeah, you gotta up your sock game.
I've never noticed that. And in school, there were a lot of students who had the Atlas, just Atlas socks.
Chiropractic college, yes. Okay, so. Can anybody, just from looking at Dr. Sweeney's spine on the table, does anybody, if you had to kind of guess, remember, obviously we would like to see kind of 4 natural curves in the spine, but just by looking at them on the table, if you had to kind of guess using your chiropractic cap, where might you think there might be some energy or tension stored in the system? And just feel free to shout it out. Upper here?
Mm-hmm.
Yeah, what makes you say that, Melissa?
It's a little flash.
Just where it's kind of like the angle's a little bit flatter through there? Absolutely, yeah. Anybody else have any thoughts, comments? Well, I would say, you can't really see it from your angle, but there's a little bit of a rotation in his lower spine. So there's a little bit of slightly higher on this side and a little bit rotated on that side. So just because, that's the angle I can see it on. Just look at it this way. Just look down that so you can kind of see how it's a little bit rotated there. See how it's kind of like a little bit. We're checking you out, Dr. Sweeney.
Alright, I'm not sure.
Yeah, there's a lot of that in chiropractic office, that's for
Oh
sure.
my goodness.
Oh, goodness gracious. Okay, we do the checking the feet all the time, right? Flopsy. So, again, remember the mechanical tension in the core is generated by that central nervous system protection response. When it's really wound up like a fishing line, it will mechanically pull it tight this way and or stretch or twist it that way, like a marionette puppet, right? Okay. So one of the greatest ways that we can see from the outside is that we know the longest nerves in the spine exit from the lower spine. They travel all the way into the ankles, right? And so just like that, that's why we always traction the ankles in flexion extension, which is from top to bottom, and we move them from lateral bending, so side to side. So that little bit of movement is gently tractioning those nerve roots, and that's tugging on the cord, and it's tugging the dura. And so by doing that, we can see, is there a lot of movement? Is it a lot of movement? We know from Dr. Brieg that the degree, so the amount of elongation or stretching or twisting in the cord and the duration, how long it's been there, so the amount of it and how long it's been there is in direct correlation to pathology. And he was a neurosurgeon, and so he had outstanding results as far as neurosurgery goes for doing laminectomies to create more mobility in the cord. So rather than the system being compressed, he would take a back of the vertebrae off so that he would actually support more movement. So that's where Dr. Epstein kind of looked at a lot of the research out there in various fields to develop this technique. Now we're going to try to assess what part of the spine is the most, where his body is asking us to address, rather than our traditional history, which would say, this is lifted, let's smush it. This is kind of elevated, let's smush it. We have to do it a little differently. We look at the body and say, hey body, we're going to assume that you are brilliant beyond anything I can comprehend. And so I'm going to know a few things and kind of ask you some questions, and you show me where I need to be, and I'm going to kind of meet you there. Turn your head to the left side if you would, and I'm looking for changes in the ankles or the Achilles. Turn your head to the right side if you would. There's a little tiny, what we call a Z-flake, a tiny bit of movement, which indicates dural tension in the C2, C3 area. Back to the middle, please. But his legs are even. Legs are coming up. We're going to bring them right back down. The amount of tension through here is moderate, not high, not low, but so that's a good indicator too. If the system had a lot of tension, I would not be doing, level 2 or transform care. I would be going back to level 1 to help the body just dissipate surface tension. When your system's all jacked up, it's not a day to learn something new, right? It's a day to just go like, help me take a breath for today, right? So I'm palpating to see, is there what we call rapport, right? Is there any access to the system where the system's like, yeah, find me here. So when I palpate up through here, there's a lot of rapport. So just touching that little part of his spine through here, I can feel my fingertips sinking in. So that's a good indicator. So the first part of, and his breath opened up. First part of level 2, like I said, there's a stretch response. So we're gonna help the body transition from breath alone into facilitating a little bit of elongation in one or two of the planes of motion where the system stores tension, either this direction, flexion extension, or lateral bend. Okay, and that's why we do it. So I'm gonna take a contact right here. And typically the contact's a little longer than level 1 because we're asking the brain not just to dissipate tension, we're saying, hey, focus here, check this out. This is something, you did the best you could, but you put some stuff underneath the surface through here, and we're saying now it's time to find it, that's it, and start to free it up. So I'm coming back here with a contact, I'm hanging out with him, And I know there's more, so I might actually encourage him to lift it up a little bit. So sometimes we'll talk to you and say, hey, find this place here. Because sometimes we've done such a good job at putting tension in our system, we've almost forgot how we did it and how to find our way out. So I'm holding the contact a little longer, a little bit of lift. Right there, and I lost rapport, so I took my finger off. Now he's staying with that. Now as we find stretch in one spot, we may notice other associated places. It's like the body under stress will distort at one place, but it'll try to put it other places to help us get through those stressful moments, right? So typically when you'll see a stretch, you can kind of look and see where else in the system is related. So right there for sure, I know he's moving between two. That's it, right there. So I'm gonna come and gently just kind of help draw a little bit of attention to see if we can take some of that and try to help the system kind of reclaim it, bring it back home. There we go. And there's another spot right through here at L2. That's it, right there, and that's all I'm looking for is the moment it kind of finds it and it shoots it through the spine into that gateway. I might position this just a little bit because I want to make sure his head was dropping a little lower, or lower than that little change in the curve, so I want to make sure that area stays open so his brain can make that connection. And normally in the office, I would let him work with that, right? So again, with network, we don't want to be doing everything for you. We want to help light the path so your brain can go, what am I supposed to do with that? Go, I'd be over here taking care of someone else, then I come back and then assess, okay, how did he do with that? What did his system do? Was it awesome? So, not quite what we wanted to see, so that helps me kind of guide the journey a little bit more. Now, I want to get a little more definition through here. We found it in flexion extension. We're going to now work with it a little bit in side bending. So I'm at that same spot, but instead of lifting it, I'm going to find it from the side. And again, I'm using a little bit more pressure, and then I'm kind of pressing into it, and then I'm going to lift up, and then go to the side, and then lift up. That's it. And that's it. So he's finding the vertical component really nicely. So I might just say, hey, find a little bit if you can, kind of just explore a little bit. As soon as I started saying, hey, he just started kind of moving to the side. There we go. Now, sometimes as we work with this stretch, I don't know if you've ever stretched like a tight hamstring or a tight shoulder. What happens sometimes when you get a good release? Because our emotional energy gets stored in our bodies, whether we're aware of it or not, but sometimes as it releases, it's an opportunity also for our brain to connect to how we did store tension there, so it's not uncommon for people to just have an expression of that as the system's figuring out how to unwind what it stored there. And so he's working it, right? And can you see how he's working it more to the right side than he was before, working it straight up to the ceiling? So again, in the regular office hours, I'd be, great, cool, keep working with that. I'd be over here checking, doing whatever with somebody else. And that's one of the cool things also about having an open room is, as a practitioner, you set things in motion, and then you can also be observing, from afar without really being up in somebody's business, kind of like how the response is going. You're like, okay, cool. Yeah, it's pretty cool. Yeah. So, now I could have done that stretch anywhere in his spine, right? That's just happened to be the pattern that, based on the analysis his system showed us. So in the second level, what happens in mid-level care, the stretch response is big enough that it starts to break up some adhesions and it liberates energy. And then what happens is the liberation of energy in one spot, whether it's here or here, it starts to try to make, that's what the wave develops, it starts to connect to a different spot. So two places, like two speakers at a rock concert, they start to broadcast information back and forth. One is breaking the boundaries of how it bound up energy. The other one is starting to be something new, and the development of that wave is what starts to break up the physical adhesions, the stress response for how we've locked up, tightened up, restricted ourselves to a response to stress or a habitual experience of stress, or where the biochemistry, maybe through diet or an organic insult or exposure to toxicity may have shut down or created a consistent chronic inflammation response. So the wave going through there breaks up the broadcast of the nervous system and frees the energy up, and the energy as it gets frees up is what starts to form the basis of the wave. So once we start to see that, then we want to actually support the system becoming more unbound, right? More destabilized, and kind of break up the stuff that it's been working with. So guess what? Rather than having him lay face down on a table, which is a pretty secure place, we start changing the position of the person around. I have options. I could have him sit up and have him kind of start to work off balance a little bit, so the brain's like, whoa. But it's a good whoa, right? That's the whoa that's needed for the system to go reassess. What? I've always been, but what? I don't quite get it. And that's exactly where that just gently, in a friendly way, challenges the nervous system to start to look outside of what it's adopted as what it called normal in a positive way, so it starts to look like, oh wow, that's weird. So I could do that. I could also put him on his side to help the wave develop in a little more stable position. In his particular case, I'm going to have him do that. So I'm going to have you, if you would, Dr. Smith, I'm going to have you rest head at this end of the table, facing towards me. So he's going to have his back towards you guys. And as you can see, we try to get the legs as straight as possible. I don't know if any of you remember when, and some of you haven't been there yet, but your first time on your side, it was a little weird, right? I remember for me, I was like, whoa, this is really weird. Yeah, your system's off balance for a reason. Your brain is going, I'm not sure what to do. And just for short bits, maybe a minute at the most, that's it. We want that. I traction the arm, right? And the tractioning of the arm helps move the energy through the system to wherever we want it to go. In this case, it's up here and up here. We start to use connective tissue access to the system, and I'm using the top of his shoulder here, the deltoid here, to kind of direct the wave where I want it to go, which in his case is there and there. And you can see, yep. See how his body's working the cervical oscillation back and forth, back and forth, back and forth. Good, just like that. Now I'm going to take a little bit of the bound energy that we were working with down here and do my best to help direct it. So again, we're still looking for how to take all of the stuff associated with whatever that pattern's related to and create a clear out of that phase, a clear out of that pattern of tension in the system. Bound energy from L1, L2, directing it up into the cervical gateways, and then also from here, mid-thoracics. Now, if somebody had a chronic illness, disease, stress response, those are typically the areas that we would be working to help the body clear out some of that gunk that's been in there for a longer period of time. The motion is specific. At the very end of everything I'm doing, I want to just put a little anchor into those gateways, back and forth, so the brain goes, yep, okay, cool. And the wave, that wave becomes stronger and louder than the noise that was being created by the way the system got used to binding energy previously. Doesn't take much, just like that. Middle of level 2 care, if that was his first time doing that, we'd be done for the day. You know, check him face down, see you later, see you next time. That's super successful. As we progress, we want to see the body develop not just front to back or side to side. We want to get the more movement and integrate both aspects of the way the core's lost or dropped, locked up in tension. We want to start to create a figure 8 motion between whatever 2 regions of the spine we're working with. I'm going to have you rest on your back, please, if you would. And
I
yes.
usually have to, because of the baldness and the squeaking, I have to put some kind of barrier.
Very considerate.
Very
Very
Not a
considerate.
grease spot that's not good.
Exactly, right? So, right, imagine this. Trillions of cells that make us up. All of the body tissues, organ tissues have 3 to 9 nerve endings. We're basically a matrix of connective tissue and nerve cells, right? As the system becomes more pliable, we start to tap into using the connective tissue matrix of the whole system more effectively, and the more the wave develops, it makes that communication easier and more pliable. We start working at the top of the feet, and the connective tissue on the top of the feet, to dial in whatever parts of the spine we want to see open up more, to funnel more of the energy into those openings. We call those spinal openings gateways. They're like little access points where the spine and the dura connect. So I'm kind of just a little bit of downward pressure and a little bit of traction, flexion, extension, lateral bending, figure eight, flexion, expansion, lateral bending, figure eight. So I'm doing this on his foot, lateral bending, and a little bit of a composite, bringing it together. Downward motion for flexion, extension, lateral bending, figure eight. Bringing both together, a little greater tissue depth, because I want to get a little bit more motion in those gateways. That's it. Right. Oscillation, oscillation, just like that. And then I'm going to gently stroke the upper lateral clavicles here. Underneath, I'm going to take these. Imagine you have like little threads or little strings. I can wrap them around and then send those little strings right back up through the heart and the chest wall, as if I could re-grab them and kind of elevate to allow. So one of the things that's interesting about the thoracic spine, we have two anchors to the sympathetic chain. At the bottom at C12, top at T1. So if our brain gives our body repeated information it's not safe or it's stressed out, it will create paraspinal muscle facilitation. The muscles will lock up, the torso will actually curve in like this, and it's a protection response which can affect not only our structure but also the messages that go to our organs, right? In extension, it's the opposite. It inhibits the sympathetic response. It actually promotes parasympathetic activity, which allows us to experience ourselves and our body and our life in a non-defended state. So I'm gently, because there's more energy moving through the system, I'm bringing my fingers right underneath those two little nodes, and I'm doing a little bit of this. I'm nudging the way from the back to the front, from the back to the front, and from the lower to the upper. So from the solar plexus to the heart. From here to here. That's it. That's it. I know what you're thinking. There you go. A little bit like that. That's it. So I'm expecting to see the wave travel a little further up into, so the wave can suspend some of the defense patterning in the membranes around the organs of his body. That's it. The peritoneal cavity, around the pleural cavity, the cardiac cavity. And then I'm going to come all the way here to the gateways, just like I did previously. I stroke the clavicles again. I come all the way here. I stroke the clavicles. I do want to see, let's hit the chest wall, rise up again. So it indicates the suspension of defense response and connection between the gateways. And I may also come here to the iliac crest and the hips, just because it allows for a little bit of a respiratory response. So when we are changing old patterns, it's nice to have an anchor to ease as we are making big change in the system. So the hallmarks in this portion of care is there's more of a communication of fluid movement between whatever two gateways we're working. It's not a pure front to back or side to side. There's more of a figure eight motion. We work with the suspension of the defense response. And you notice I did stroke the clavicles. And when we're stressed, one of the things that happens is our cardiac rhythms and our respiratory rhythms go opposite to each other. So we're breathing and our heart is elevated, so they kind of cancel each other out. When we're in an ecstatic state, a joyful state, a happy state, a grateful state, our breathing and our heart rhythms actually go and they synchronize together, so they amplify more volume of respiratory function, and it actually helps produce a more positive state. They've done clinical depression studies of people that actually, compared to the more traditional approach of providing like SSRI for depression, they had people stand in a mirror for 20 minutes, smiling ear to ear, in a powerful stance, shoulders back, chest up, hands on their hips for 20 minutes a day. They had a significantly higher reduction with clinical depression than did the traditional medicated results, which was very interesting. What's that?
Power posing.
Yeah, that's right. And I believe it was at Stanford that just did that research on that, and it's a really fascinating research.
Wow.
Where literally, so they had people come in for 20 minutes in a mirror, looking at yourself in the mirror, right? So you actually see yourself, and doing this actually stimulates the pineal gland and the postural receptors in the chest wall. It's no joke, right? Well, if we all were if we all were asked to like say, hey, if we were imagining in that room over there was a depressed person, what would they look like? How would their posture be? Would it be open? It would be down. Where would their head position be? Up like this? No, kind of down, right? What would their breathing be? Shallow, right? What would their voice tone be? Would it be loud and buoyant? It would tend to be more, right? How do we know all this?
Bodies are pretty wise, man.
Yeah, they are wise, and plus we've seen it patterned, right? Because that is just what is typical. So by producing a different, instead of having to go and change the biochemistry, by producing a different actual posture, you can influence the biochemistry. Plus, at the same time, we were retraining the person to be able to adopt a powerful posture. And just do it for a second. Just do it for 3 seconds. It may feel uncomfortable for some of us, right? But if you actually let yourself get into it, you can feel, does the energy go up your body or down your body? Goes up your body, right? Yeah, right? Let's have you flip over and go face down. Thanks, Dr. Sweeney, for being our demo. Appreciate it.
My pleasure.
Magnificent, magnificent work. So I talk a lot about oscillation. It's kind of a fancy word, but really it's fundamental currency of the universe. When we see, the reason we can see each other is there's energy, particles and waves, right? We know it's one or the other, or both, but those waves bounce off our retinas to produce an image, right? That allow us to see whatever we see. Same thing with our taste, right? Particles of food would break down into smaller particles when they cover different receptor sites on the tongue, sweet, sour, salty, etc. Same thing with sound vibrations. We can hear in different animals, different species can hear different frequencies of sound. The only reason that MRIs are effective as a diagnostic tool is because when you put the system in a magnetic field, each tissue oscillates at a different frequency so you can differentiate it from another tissue, right? Digestive waves, the peristaltic wave, is movement of energy and food through a tissue, right? It's through a smooth muscle. Everything is energy and everything is waves, right? So just to demystify that a little bit. We can tell when someone's happy, we can tell when someone's sad, we can tell when someone's confident, we can tell when someone's not sure of themselves because of the tone and the vibration of the voice and how it bounces off of us. These were moderately, I sometimes wonder how someone's gonna walk. I really do. I'm like, I don't know how you're gonna get out of here today, man. Good luck to you. I hope you brought a team of friends. I'm like, dang, again, it happened. You can come on up with your
Like I'm ready for bed. Thank you.
And sometimes there's that face right there. A lot of times, especially like at late level 2 at advanced gate, people get off the table and they're like, we done with me? Okay.
Stars.
What? Now you gotta know, when the wave does get up into the brainstem through there, also this fourth ventricle is where the body produces a lot of serotonin. So you're changing your biochemistry from predominantly a lot of stress biochemistry into a lot of positive biochemistry. It's pretty cool. We've got the privilege of there's a lot of really interesting people in other disciplines, including mathematicians and engineers, that are studying these waves at places like University of Southern California, and they presented papers on the waves. You can, if you want to geek out, you can go to epienergetics.org and look at there's a research header, and go to the wave. There's the research on the network wave. It's an abstract of a mathematical engineering journal that talks about what is significant and unique. The math is far beyond me, but I can read the abstracts and I can apply it or I can understand it clinically. But basically, the brain produces new response with different waves, and it means that the central nervous system, brain, body, is producing new responses that weren't there. That is a positive evolutionary response for central nervous system function and coherence, right? Coherence is a big fancy word, but when we are coherent, we're in tune with ourselves more. When we're coherent, we're also able to be in tune with others more effectively. And that is regulated predominantly by the central nervous system.
Mm.
So the last thing that I'd like to share with you and kind of give you some tools to work with in this part of care is another somatic exercise. So you probably all remember the stage 1 exercise, which is three positions, upper chest wall, bottom of the ribs, belly button. The reason why we focus on those are areas where the nerves conglomerate, you get a lot of bang for your buck in those areas as far as nerve supply goes, okay? So by linking the brain to those regions and applying both breath and movement, it hits the same cortical regions that we're after, sensory motor cortex, to become aware of that area and also to try to find it and move it simultaneously and sense, well, can I find it? Oh wow, that one I can find really easily. Where is that one? It's really hard for me to move. Ooh, when I move that one, this one wants to move too. Interesting. Even if at the beginning stages it's not perfect, it's okay. Just the act of sitting down and doing it for 5 minutes is literally lighting off those parts of the brain, which is a huge evolutionary win and gain for your central nervous system and productive that we're doing on the table. So don't stop doing those 3 positions. Keep doing them as a baseline. Take 2 minutes just to kind of see where your system's at, and then move into this one. So I'm going to show you this one right now. I typically suggest, I'm going to pull this over so I can be closer to you guys. I typically suggest doing it on laying on your back, although I do often teach it sitting up to people just because it's easier in a class format. But you want to do it gently, laying on your back. Legs can be straight, legs can be bent. Really, it's what's easiest for your body. So you've done your 3 position check-in, right? And then the easiest way to kind of work with what's called stage 2 is by having the hands be the furthest distance away from each other, right? Because the brain has an easier time kind of differentiating 2 spots when they're closer together. For most people, it's a little bit more challenging at first. So one hand on one part of your body, let's say the belly button, and then the other hand is on the top position, so where the sternum meets your breastbone. And you want to breathe, pick one arbitrarily, so I just started with the belly button. As I breathe in, I am lifting the muscles, and as I exhale out my mouth, I bring the muscles back into my spine. And then I switch to this hand. I breathe in and lift the chest wall. I exhale and let the chest wall sink into my spine. As this one finishes, then I switch. Back to the belly button. Chest wall. Belly button. At a certain point, you start to develop a wave between those 2. And there's moments where it feels effortless and the communication starts to be established between those regions. So at first it takes a little bit of focus to find one and the other, and then one and then the other. And it's something kind of, usually about 30 seconds, 45 seconds in. Something feels like it just starts to click a little bit. So that's the exercise. So keep doing the 3 position breathing, okay? A couple minutes, because that kind of warms the system up. And then split the hands. And in the nose and out the mouth into one place. In the nose and out the mouth into the other place. And then just starting to kind of find your way back and forth. That also also will start to kind of create a little bit of a rippling in the structure, and so as it works, as you continue to do that, it'll make your system more kind of, it speaks the same language as the strategies that we're looking to develop on the table as well. Cool. Awesome. Last thing I'd love to share with you guys is, first of all, you guys are amazing. You chose to be here tonight. There's a lot of other places I know you can be, and I appreciate your time. It is without question, in 25 years of practice, honestly, I can say the people that show up to these workshops get better results, they get better changes, and what we're doing has a greater impact in their lives. So I thank you for taking the time out of your day, out of your night to be here. And I also like to make a plea or a request, is that we're a very small office doing little tiny things to make an impact as much as we can in our community. And the only way that we can do that is with your help. And so I know most everybody in this room has shared the work that we're doing with people in their lives, and so I'm so grateful. I'll tell you, just like telling you the story about Ivan, that's why we do what we do. Another little girl that I was taking care of today, who is now going from not going to the bathroom for every 3, 4, sometimes 5, 6 days to going twice a day. Her mom is just like, oh my God, her mood has changed, her whole life has changed. We had to, anyways, just the way she would move through the world is so different. So please, if people pop in your mind, let them know about the work we're doing here. As always, if there are people that pop up in your brain, we do these big events like Patient Appreciation Day. We only do those once or twice a year, but if there is anybody that you're thinking of right now, let Dr. Sweeney know. At my workshops, we give these little little Amazon gift cards, but they're chiropractic gift cards, and they're $100 off the initial couple visits. So if you have anybody, they're good for 2 weeks, so there's a little expiration date on them. Dr. Sweeney should be able to have them, and if you want one, just let him know. He can give you, I think, up to 2 is what we kind of usually let people take if they do. But other than that, have a phenomenal night, and thank you so much, and we'll see you on the table real soon. All right? Thank you. And you guys will be seeing me and Dr. Sweeney as he rotates more in. I'm out this Thursday, Friday. I'm heading off to an advanced training with our teacher, the guy that developed this technique. So Dr. Sweeney will be taking over for a couple days, and he'll be more in the mix. So have a great rest of your evening, great night. See you guys very, very soon. Thanks. I'm so glad you could make it. Bye.